Every day, thousands of adults over the age of 60 lose a little more kidney function without realizing it. There is no sudden alarm, no dramatic pain, and often no obvious warning. Instead, it begins with small changes: feeling more tired than usual, noticing your socks leave deeper marks around your ankles, or waking up one extra time during the night to use the bathroom. Most people assume these are simply signs of getting older. But what if they aren't? What if your kidneys, the two silent organs working around the clock to keep your body alive, have been trying to tell you something for months or even years? I'm Dr. Richard, and today we're going to uncover 9 early warning signs that your kidneys may be struggling after the age of 60. These aren't symptoms designed to frighten you, they're signals your body may send long before kidney disease reaches an advanced stage. The earlier you recognize them, the more options you may have to protect your health. Stay with me until the end, because the number one warning sign is one that many people mistake for a heart or lung problem, when in reality, the kidneys may be playing a major role. Your body's silent filter. Imagine the water filter in your kitchen. Every day, it removes tiny particles and impurities from your drinking water. At first, even when it's starting to clog, the water still looks clean. You may not notice anything wrong, but over time, the filter becomes less effective, and eventually it can no longer do its job. Your kidneys work in much the same way. Every single day, these two fist-sized organs filter roughly 180 liters of blood, removing waste products, balancing fluids, regulating minerals, and helping control blood pressure. They also play an important role in keeping your bones healthy and signaling your body to produce red blood cells. The remarkable part is that your kidneys have a tremendous reserve capacity. Even after losing a significant amount of function, they often continue working well enough that you feel completely normal. That's why kidney disease is often called a silent disease. As we grow older, that reserve naturally decreases. High blood pressure, diabetes, certain medications, and years of normal wear can place additional strain on these hardworking organs. The result is that subtle warning signs may begin appearing long before many people think to have their kidneys checked. Let's begin with the first one. Warning sign number 9, changes in urination. For many people, the very first clues appear in the bathroom. Perhaps you're getting up several times during the night to urinate when you used to sleep through until morning. Maybe you're producing much more urine than usual, or surprisingly less. Some people notice a weaker stream, while others feel they can't completely empty their bladder. Not every change means kidney disease. Enlarged prostate, medications, fluid intake, or bladder conditions can also affect urination. But persistent changes deserve attention, especially if they're new. I remember a patient I'll call Robert, a 69-year-old retired teacher. He thought waking up 3 or 4 times every night was simply part of aging. He even joked that everyone his age had the same problem. During a routine checkup, we discovered that his kidney function was lower than expected. Thankfully, because the problem was identified early, adjustments to his blood pressure treatment, diet, and regular monitoring helped slow further decline. The lesson wasn't that nighttime urination always means kidney disease. It was that small changes shouldn't automatically be dismissed as just getting older. Your body often whispers before it shouts. Warning sign number 8, foamy urine. The next sign is something many people notice but rarely mention. Have you ever looked into the toilet and seen urine covered with persistent foam or bubbles that don't disappear after a few seconds? Occasional bubbles can simply happen because urine hits the water quickly. That's completely normal. Persistent foamy urine, however, can sometimes indicate that protein is leaking into the urine, a condition known as proteinuria. Think of your kidneys as an incredibly fine coffee filter. Their job is to keep important proteins inside your bloodstream while allowing waste products to pass through into the urine. When that filter becomes damaged, some of those proteins can begin slipping through. Protein in the urine doesn't always cause symptoms you can feel, but it may be one of the earliest indicators that the kidneys are under stress. This is why doctors often order a simple urine test during routine health checks. It can reveal problems long before someone experiences pain or serious illness. If you've repeatedly noticed unusually foamy urine, especially together with high blood pressure or diabetes, it's worth discussing with your healthcare provider. Remember, the goal isn't to diagnose yourself at home. The goal is to recognize patterns that deserve professional evaluation. And while these first 2 signs are easy to overlook, the next warning sign often appears somewhere people least expect: their feet. Warning sign number 7, swollen feet and ankles. Have you ever taken off your socks at the end of the day and noticed deep marks around your ankles? Or perhaps your shoes suddenly feel tighter than they used to, even though your weight hasn't changed? Many people assume it's because they stood too long, the weather was hot, or they're simply getting older. Sometimes that's true, but persistent swelling, especially in the feet, ankles, or lower legs, can also be a sign that your kidneys are struggling to remove excess fluid from your body. Think of your kidneys as your body's drainage system. When everything works properly, extra salt and water are filtered out and leave through your urine. But when that filtering system becomes less efficient, fluid can begin collecting where gravity naturally pulls it, your feet and ankles. I remember a patient I'll call Linda, a 72-year-old grandmother who loved gardening. She told me she had started buying larger shoes because her feet felt swollen every evening. She assumed it was arthritis. She assumed it was summer heat. She assumed it was just another part of getting older. A routine blood test later revealed that her kidney function had declined significantly. Fortunately, because it was discovered before permanent complications developed, her care team adjusted her medications, improved her blood pressure control, and recommended dietary changes that helped reduce the swelling. The important lesson isn't that every swollen ankle means kidney disease. Heart conditions, circulation problems, certain medications, and even long periods of sitting can also cause swelling. But if swelling is becoming more frequent, affecting both legs, or appearing alongside other symptoms we're discussing today, it's worth having it evaluated. Your kidneys rarely send only one signal, they usually leave a trail. Warning sign number 6, constant fatigue. Now let's talk about one of the most commonly ignored symptoms. Feeling tired. Not the kind of tired you feel after a busy day. I'm talking about waking up exhausted even after a full night's sleep. Feeling like your energy disappears before lunchtime. Finding simple activities, walking the dog, grocery shopping, climbing stairs, much harder than they used to be. Many seniors naturally blame aging. But your kidneys may be contributing in ways most people don't realize. Healthy kidneys produce a hormone called erythropoietin. Its job is to tell your bone marrow to make red blood cells. Red blood cells carry oxygen throughout your body. When kidney function declines, your body may produce less of this hormone. Over time, this can contribute to anemia, meaning your muscles and organs receive less oxygen. Imagine trying to drive across the country with only half a tank of fuel. The engine still runs, it just doesn't perform very well. That's often how fatigue from kidney disease feels. Slow, heavy, persistent. It's not laziness, it's not simply old age, it's your body struggling to keep up. One gentleman I treated, Michael, was convinced retirement had simply made him slower. He stopped golfing because he became exhausted after only 9 holes. His wife noticed he spent more afternoons asleep in his chair than enjoying the hobbies he once loved. Testing revealed moderate kidney disease along with anemia related to reduced kidney function. With proper treatment, improved nutrition, and careful management of his underlying conditions, his energy gradually improved. The takeaway? Persistent fatigue has dozens of possible causes, including thyroid problems, heart disease, poor sleep, depression, and vitamin deficiencies. Kidney disease is simply one possibility that deserves consideration, particularly when fatigue appears alongside other warning signs. Warning sign number 5, puffy eyes in the morning. Now here's a symptom many people notice in the mirror. You wake up, you look at your reflection, and the area around your eyes looks swollen or puffy. Most people blame allergies, or a poor night's sleep, or maybe eating something salty. Sometimes they're right, but persistent puffiness around the eyes can occasionally be another clue that protein is leaking through damaged kidney filters. Remember the coffee filter analogy we talked about earlier? When that filter develops tiny holes, proteins that should stay inside your bloodstream begin escaping into your urine. As protein levels in the blood decrease, fluid may shift into surrounding tissues. One place this often becomes noticeable is the delicate skin around the eyes. Because the tissue there is so thin, even small amounts of fluid can create visible puffiness. This doesn't mean every puffy eye signals kidney disease, far from it. Sinus problems, allergies, lack of sleep, and many other conditions are far more common causes. But when morning puffiness repeatedly appears together with foamy urine, swelling in the ankles, or persistent fatigue, the bigger picture becomes much more important. Medicine often works like assembling pieces of a puzzle. One piece alone doesn't reveal much. Several pieces together can reveal the entire image. A quick pause. Before we continue, I'd like you to think about something. Have you noticed any of the warning signs we've discussed so far? Maybe waking more often to urinate, maybe swollen ankles, maybe constant fatigue, or perhaps puffy eyes that never seem to go away. If one or more of these sounds familiar, don't panic. Many common conditions can produce similar symptoms. Instead, consider it a reminder to schedule a conversation with your healthcare provider and ask whether your kidneys should be evaluated. A few simple blood and urine tests can provide valuable information. And if you're finding this video helpful, let me know by clicking the like button. It helps more older adults discover information that could encourage earlier conversations with their doctors, because the next three warning signs are often dismissed as completely unrelated to kidney health. Yet they're among the most overlooked clues of all. Why your skin and even your muscles may be revealing far more about your kidneys than you ever imagined. Warning sign number 4. Dry, itchy skin. Let's move to a warning sign that surprises many people because it doesn't seem connected to the kidneys at all. Your skin. Have you found yourself scratching more often lately? Perhaps your arms, legs, or back feel unusually dry no matter how much moisturizer you use. Many people assume it's simply part of aging. And yes, our skin naturally becomes drier over time, but your kidneys also play an important role in maintaining the body's balance of minerals, fluids, and waste products. When they're no longer filtering efficiently, those imbalances can sometimes affect the skin. Think of it this way. Imagine your home has a high-quality air filter. When it's clean, the air feels fresh. But once the filter becomes clogged, dust slowly starts settling on every surface. Your kidneys work in a similar way. When waste products begin building up in the bloodstream, your skin may become one of the first places your body reflects that internal imbalance. I remember a patient named Carol, a 70-year-old retired librarian. She wasn't worried about her kidneys. She came to see me because her skin had become so itchy she struggled to sleep. She had already changed soaps. She bought expensive moisturizers. She even blamed the weather. During her evaluation, routine blood work revealed reduced kidney function that had never been diagnosed before. Was her itchy skin caused only by her kidneys? Not necessarily. Dry skin has many possible causes, including eczema, allergies, diabetes, thyroid disease, and simply getting older. But in Carol's case, it became one important clue that led to discovering a much larger health issue. That's why it's so important to look at the whole picture rather than one symptom in isolation. Warning, sign number 3, frequent muscle cramps. Now let's talk about something many older adults experience, sudden muscle cramps. Perhaps they wake you in the middle of the night. Your calf suddenly tightens, your foot curls painfully, or your hands cramp while doing everyday tasks. Most people immediately think, I need more bananas. While dehydration or low potassium can certainly cause cramps, kidney problems may also contribute. Healthy kidneys carefully regulate important minerals like calcium, sodium, potassium, and phosphorus. These minerals allow your muscles and nerves to communicate properly. When kidney function declines, that balance can be disrupted. Think of your muscles like musicians in an orchestra. Each one depends on precise timing. If even one instrument starts playing out of rhythm, the entire performance becomes chaotic. Your kidneys help keep those chemical signals in perfect harmony. When that balance changes, your muscles sometimes respond with painful cramping. One of my patients, George, was convinced his nighttime leg cramps were simply the result of spending years working construction. Every evening around 2 or 3 in the morning, he'd wake up with severe pain in his calves. Stretching helped for a few minutes, then the cramps returned. When we reviewed his overall health, we discovered he also had high blood pressure and early chronic kidney disease. Once his treatment plan addressed both conditions, and after careful monitoring of his electrolyte levels, his nighttime cramps became much less frequent. Again, muscle cramps alone do not diagnose kidney disease. Exercise, dehydration, nerve disorders, certain medications, and circulation problems are all common causes, but recurring cramps deserve attention, particularly when they appear together with several of today's other warning signs. Warning sign number 2, loss of appetite, nausea, or a metallic taste. This next warning sign often develops so gradually that families don't notice it until months later. Food simply doesn't taste the same anymore. Maybe your favorite meals suddenly seem bland. Perhaps you develop a strange metallic taste in your mouth, or maybe you feel slightly nauseated after eating. Some people even begin losing weight without trying because eating no longer feels enjoyable. Here's why this can happen. As healthy kidneys remove waste from your bloodstream, your body's internal chemistry stays remarkably stable. But when waste products begin accumulating, they can affect many systems, including your digestive tract and even your sense of taste. Imagine forgetting to take the garbage out of your kitchen for several weeks. Eventually, the smell begins affecting everything around it. Likewise, when waste products aren't removed efficiently, your entire body begins noticing the difference. I once cared for a gentleman named Thomas, age 74. His daughter scheduled the appointment because he had lost nearly 10 pounds over several months. Thomas insisted he wasn't sick. "I'm just not hungry anymore," he kept saying. Blood tests eventually showed his kidney function had declined considerably. Once treatment began and his overall health was carefully managed, his appetite gradually improved. It's important to remember that poor appetite has many possible causes: digestive disorders, depression, medication side effects, cancer, liver disease, even dental problems. But kidney disease belongs on that list, especially when several other warning signs are also present. The pattern matters more than one symptom. By now, you've probably noticed something important. None of these warning signs proves someone has kidney disease. Dry skin alone doesn't, muscle cramps don't, poor appetite doesn't, even swollen ankles don't. Medicine rarely works that way. Instead, doctors look for patterns. It's like being a detective. One clue tells part of the story, 5 clues together tell a very different story. If you've recognized several of today's warning signs in yourself or someone you love, it doesn't mean you should panic. It means it's time to ask questions, because the final warning sign we're about to discuss is the one that sends many people to the emergency room. Ironically, most don't realize their kidneys may have been warning them for years before it ever happens. We'll reveal the most serious warning sign, the simple tests every adult over 60 should know about, and 5 practical habits that can help protect your kidneys for years to come. Warning, sign number 1. Shortness of breath. We've reached the most important warning sign on today's list, and it's also the one that surprises people the most, because when someone becomes short of breath, they usually think about their lungs or their heart. Very few people think about their kidneys, yet your kidneys and your heart work as a team. When healthy kidneys can't remove enough excess fluid, that fluid doesn't simply disappear. It stays inside the body. Over time, it can begin collecting in places where it doesn't belong, including the lungs. Imagine trying to breathe while carrying a backpack that gets heavier every single day. At first, climbing one flight of stairs feels slightly harder. Then walking across a parking lot leaves you winded. Eventually, even getting dressed can make you stop to catch your breath. For some people, that's exactly how advanced kidney disease begins to affect daily life. I remember a patient I'll call Helen, who was 76 years old. She came to the clinic convinced her asthma had returned. After many years without symptoms, she became breathless while making the bed. She couldn't finish her usual morning walk. At first glance, it seemed like a lung problem. But after examining her and reviewing her blood work, we found that declining kidney function had allowed excess fluid to build up in her body. Once she received the right treatment, her breathing gradually improved. Now, it's important to be clear. Shortness of breath is never something to ignore. It can be caused by heart disease, lung disease, blood clots, severe anemia, infections, or many other serious conditions. If you develop sudden or severe shortness of breath, especially with chest pain or difficulty breathing, seek emergency medical care immediately. But when it develops gradually, alongside swelling, fatigue, changes in urination, or several of the warning signs we've discussed today, your kidneys deserve to be part of the conversation. How doctors check your kidney health. One of the biggest misconceptions I hear is this: "Doctor, my kidneys don't hurt, so they must be fine." The truth is, kidney disease often causes no pain at all until it's very advanced. That's why doctors rely on simple laboratory tests instead of waiting for symptoms. The first is a blood test called creatinine. Creatinine is a waste product produced naturally by your muscles. Healthy kidneys remove it from the bloodstream. If creatinine levels rise, it may suggest the kidneys aren't filtering as efficiently. Using your creatinine level, along with your age and other factors, the laboratory calculates another important number called your estimated glomerular filtration rate, or eGFR. Think of eGFR as a report card showing how well your kidneys are filtering your blood. The second important test is a urine albumin test. Remember the coffee filter analogy? Healthy kidneys keep important proteins inside your bloodstream. If protein begins leaking into the urine, it may be one of the earliest signs of kidney damage, even before you feel sick. These tests are quick, inexpensive, and widely available. If you're over 60, especially if you have diabetes, high blood pressure, heart disease, or a family history of kidney problems, ask your healthcare provider whether routine kidney testing is appropriate for you. 5 habits that help protect your kidneys. The good news is that many people can support kidney health through everyday habits. Here are 5 simple but powerful steps. 1. Keep blood pressure under control. High blood pressure is one of the leading causes of kidney damage. Monitoring it regularly and following your treatment plan can make a meaningful difference over time. 2. Manage blood sugar. If you have diabetes, keeping your blood sugar within the target range recommended by your healthcare provider helps reduce stress on the kidneys. Even modest improvements can have long-term benefits. 3. Stay hydrated, but don't overdo it. Most people benefit from drinking enough fluids throughout the day. However, there is no magic number that works for everyone. People with heart failure, advanced kidney disease, or certain medical conditions may need individualized fluid recommendations. Follow the advice of your healthcare provider rather than forcing excessive amounts of water. 4. Be careful with pain relievers. Some over-the-counter pain medications, particularly non-steroidal anti-inflammatory drugs, NSAIDs, can affect kidney function, especially when taken frequently or in high doses. Always use medications as directed and discuss regular use with your doctor or pharmacist. 5. Stay active and eat a balanced diet. Regular physical activity, maintaining a healthy weight, limiting excess salt, and eating a balanced diet rich in fruits, vegetables, whole grains, and appropriate sources of protein can all support overall health, including your kidneys. Small daily choices often matter more than dramatic short-term changes. Final thoughts. If there's one message I hope you take away from today's video, it's this. Your kidneys are incredibly hardworking organs. They filter your blood every minute of every day without asking for attention. And when something begins to go wrong, they usually don't scream. They whisper. Maybe it's swollen ankles. Maybe it's waking up several times during the night. Maybe it's fatigue you've blamed on aging, or skin that seems unusually dry. None of these symptoms automatically means kidney disease. But together, they may be your body's way of saying, please don't ignore me. The encouraging news is that kidney disease found early is often easier to manage than kidney disease discovered late. That's why paying attention to subtle changes and having regular checkups can make such an important difference. If today's video helped you better understand your kidney health, I'd love to hear from you. Which warning signs surprised you the most? Leave your answer in the comments below. Your experience may encourage someone else to schedule the appointment they've been putting off. If you found this information valuable, please like, subscribe, and turn on notifications so you don't miss future videos on healthy aging, brain health, heart health, nutrition, and natural ways to protect your body after 60. Thank you for watching, take care of yourself, and I'll see you in the next video.